want to welcome you to our second session on our wellness series for providers, Coping with Grief. My name is Kate Tram, and I'm here with Avis Garcia, who's going to be presenting today. And also on the line right now is Cindy Sago, our program coordinator for the National American Indian and Alaska Native Prevention Technology. We are part of the Prevention Technology Transfer Center Network. There are 10 regional centers shown on this map, as well as a network coordinating office and the National Hispanic and TTC. I want to let you know that you can earn CEUs for attending this. So we will be sending a follow-up email to everyone who attended, and it will include links to the recording, handouts of the slides, and also if you get that email, you can simply reply to it and request CEUs, and we will send you a CEU for attending. We are currently waiving all of our fees during quarantine, and so we hope that that is helpful to people, and I hope you can take advantage of that. I should say we are a NAEP certified educational provider, so you may need that. It's a certification for addiction counselors, and so it may not apply to all of those of you who are on the line. We're looking into more options for being able to offer CEUs, so we would welcome your feedback and the type of CEUs you might be looking for in your work. We would, yeah, we would love to be able to help out with that more. But yeah, we're always looking into options for that, so please let us know. We also do have a short survey that we would love to have you fill out after the webinar. I'll be putting the link to this in the chat box towards the end of the session. And so if you wouldn't mind taking a few minutes to fill that out when we get through here, we would love to hear your feedback. And of course, we welcome, I welcome your emails and comments and anything you want to put in the chat as well. But this is, of course, an anonymous survey. So if you have things you would like to say anonymously, that is the best place to do it. Our Adobe Connect, sorry, this is the wrong slide. I forgot to change this. We are switching from Adobe Connect to Zoom for all of these meetings. So you will see on the bottom of your screen, you should see a chat icon that you can open up the chat pod where you can ask questions and share comments. We will, for our webinars, be keeping all the participants muted so that we can, allow our presentation to be, as uninterrupted as possible. And at the end, we will open it up for questions, and so we may be able to unmute people at that point if you would like to ask a question that way. And I want to introduce our speaker for today. We have Dr. Avis Garcia. She is an enrolled member of the Northern Arapaho Nation and is affiliated with the Eastern Shoshone Tribe of Wyoming. She is a licensed professional counselor and addiction therapist and has worked for 19 years as a mental health provider in the treatment of Native American youth and families. So she's coming with some really wonderful experience into this topic, and we got a great start on this series last week, just talking about self-care, and this session I know is going to be talking about grief and some really difficult topics, but the wonderful thing about Avis is she's really comfortable speaker talking about difficult subjects and just giving you with hope, even in really difficult circumstances. So I'm so excited to have Dr. Garcia here with us today, and I want to welcome you and pass things over to you now.
Thank you. I heard you say I have a way of talking about difficult topics. This is another one of those subjects that is hard to make it entertaining, and it's also one of those subjects that can bring up some intense emotions and feelings. So I want to remind everyone to make sure that you take care of yourself today and to do your self-care. A lot of this work all comes down to how well you take care of yourself. And I'd also like to take a moment to think of some people that are struggling right now with their own grief and loss, and that are hurting and are in pain, and that they get the help that they need to manage their grief and loss and work through it and be able to move on. And just wanted to give them a moment. Okay. We're ready to move slides. This is just a picture of me, so you know who I am. I thought this Zoom would show me, but it might not, so you'll be seeing my slides. There also is my contact information should you want to reach out for anything. And if you have any suggestions for future topics, I'm definitely interested in that. You can go on ahead and switch to the next slide. Today's learning objectives, the first one is to understand the components of grief and loss, to dispel myths and conceptions about grief and loss, explore how grief affects the individuals from a physical, emotional, psychological, behavioral, and spiritual perspective. 2 is to define complicated grief, identify when grief is complicated, and explore ways to help individuals address their complicated grief. And 3, to define complicated grief, identify when it's complicated, and explore ways to help individuals and also ways to help yourself as well. You can switch to the next slide. I like to use a lot of quotes when I'm doing my presentations. They just seem to resonate with me. You can go back when today's quote is, "Let grief find the freedom to be expressed. Let grief find the right to be understood." So everyone experiences grief in a different way. No two people experience that grief the same. And a lot of my experience with grief, I've shared with a lot of my clients that I work with, is before I even became a counselor, I had a lot of life loss in my own life, and it took me a long time to get through it. And part of my being in the profession I am in is wanting to help people get through difficult times in their life and know that things are gonna be okay. And so, like I said, I share with my clients when we're talking about grief and loss that my experience is a lot different than someone else's. And like I said, I've been through a lot of loss in my life. In our first session, I shared my very first significant loss was the loss of my own brother to suicide. And that was probably, when I look at all of the grief that I've gone through, was probably one of the most difficult to go through. And I lost both of my parents, my mother and my father. Although I was raised by my grandparents, I lost them later. So I've lost uncles. So I've lost a lot of family members, but along the way, I always had my grandmother to lean on, who also experienced a lot of loss in her life. So a lot of what I learned was from my grandparents and how they raised me. And I'll share bits and pieces of that throughout this presentation today. Go on to the next one. Why talk about grief? Because change happens. To live is to experience loss. We all go through it at some point in our life. And we all have little deaths in our life that, we experience through maybe losing jobs or losing things or moving. So there's grief related to a lot of things. Change is inevitable and growth is optional. That's a quote from Walt Disney. So grief can be a growing process as well that takes time. It's how we integrate the losses we explore into our own lives, how we adapt to the changes that move us forward and to new definitions of ourselves. We do change from our losses. Growth happens from living through the loss and redefining ourselves Anytime there is a change, a loss is experienced, whether you realize it or not. To clear the air about some of the myths and misconceptions about grief and loss. Anger is not a normal response to loss. A grieving person should minimize feelings. It takes 2 weeks to 3 months to get over grief. All losses are the same. Everyone grieves differently. Grief and loss is only attributable to death. Again, these are myths and misconceptions. Anger can be a normal response. It is one of the stages. And we shouldn't be in a situation to have to minimize feelings when we're going through that. You need to experience that and go through that. And it takes a lot longer than 2 weeks to 3 months to get over grief. All losses are not the same. And yes, we are all different. But when I share a couple of theories with you, you'll see that there are some common themes that do show up. And that grief isn't only attributable just to death only. We have a lot of other losses that we go through that aren't related to death at all. Next slide. Some facts about grief. Trying to ignore your pain or keep it from surfacing will only make it worse in the long run. And that's with any difficult emotions that we might be feeling. I work in a substance abuse treatment agency, so I'm always telling my clients that when you keep all of those feelings that's really bothering you to yourself, you're coming to group and you're presenting with a happy face, I'm fine, everything's good, you're not addressing what's really underneath that needs to be dealt with, and it builds up and it gets worse. Feeling sad, frightened, or lonely is a normal reaction to the loss. Showing your true feelings can help you and others deal with the grief. Crying is normal, but it's not the only response. And there is no right or wrong time for grieving. There is a dual processing model by Strobe. It is his theory of how to address grief in the stages that people go through. And it focuses on the person's feelings and focusing on the practical tasks that we need to do every day to help move through the loss. So it shows that we bounce back and forth between feeling our grief and then trying to live our normal day-to-day life as we always have before the loss occurs. You can go to the next slide. Grief, what is it? The definition I'm sharing with you today is deep or intense sorrow or distress, especially at the death of someone. It is something that causes distress and suffering as a response to loss. And the main goal of grief work is to more fully engage in life and to be open to the future. The next slide. Grief is a normal reaction to loss. It's a continuing process with many changes. It's a natural reaction, and it is a reaction to the experience of many kinds of losses and not just death alone. No relationship is like another. How a loss impacts us will depend on the unique relationship we had with what is lost. If a person perceives the loss as important or life-altering, then that is what it is. Additionally, the impact of the loss can be magnified by the number of losses experienced over time. Our reserve for coping with loss can be depleted if there are too many within short periods of time. Some people have experienced a lot of loss in their life, and some have had many, like I shared with you. My own, when I looked at the time frame, I remember it was like every 2 years I was experiencing a significant loss of a close family member. And I didn't really look at it until I had gone through it and looked back at my past and where I've gone to and what I've been through. And so I didn't realize that those were significant losses. So it was probably just getting over one and then having another one. And right now with this this COVID virus and seeing what's going on in like some of the major cities is just like, it's just, I don't even have any words to explain it. I've just seen that there's so many losses out there, and people with the situations going on aren't even getting a chance to grieve as they normally would with what we're dealing with right now. So it's complicating it that much more. Can change the slide. Loss is the absence of a possession or future possession, or the absence of a relationship. The type of loss, the situation surrounding the loss, your personality, and the characteristics of the unique relationship with what was lost, how significant the loss is to you, will all impact how your grief looks and how long it lasts. For very significant losses, the grief may never go away altogether. It may ease for a while, only to resurface at key anniversaries or holidays. And one of the quotes I got from Dr. Phil, I watch him pretty regularly, and he's done some grief counseling right on his show. And he talks about the depth of the grief, the breadth of the grief, and the longevity of one's grief. Doesn't show how much you love that person, because the people that he's worked with have experienced complicated grief of not being able to move on in their life. So they feel that if they don't continue grieving, that they're not showing how much they cared for that person. So he really helps them realize that you know, doing that is not going to help you to get better. This is if we were in person, this is a good brainstorming exercise to look at some of the losses we all experience. A lot of us don't realize the different things that we go through. And I talked in the last session about this COVID having some disenfranchised grief elements to it, that a lot of us are grieving how things were before this virus occurred. And so there's different losses in our life. We'll change the slide. Here's some of the losses I'm talking about. The loss of a spouse through death or divorce, the loss of a parent or a child through death or divorce, loss of a family member or a friend, miscarriages or abortions, loss of a beloved pet, or just the loss of a relationship. A lot of kids were missing their teachers and being in school with their friends this year. So everybody is experiencing loss on some level these days. You can change the slide. Some other various losses could be a loss of functioning through disability. Someone can lose their sight, their hearing, or just their ability to be mobile. So that is another loss that people have to come to terms with. Loss of identity. And this loss of identity really brings me back to working with people in the addiction field, where they've spent so much of their life, some of them half of their life or more by the time they come to treatment, of their identity is all tied to their use of substance and associating with certain kinds of people. So it is a big loss for them when they come to treatment and decide to get into recovery. That's something that where they felt important and they belonged. And so we have to address that to help them change their identity to that of someone more positive, to let that past go. Losing a sense of security. Some women, well, not just women, but anyone going through a divorce, you could lose that sense of security of having someone there to help you feel safe and provide everything that you need. Maybe losing your home or downsizing your home and things are changing there. Some experience a loss of childhood through abuse and neglect. Again, this is a common theme I find in working in the substance abuse field, that a lot of people who've had the adverse childhood experiences, the ACEs, they don't realize that they really didn't fully enjoy their childhood because of how their life happened when they were younger. So there's a lot of stuff on top of it. Some people lose their job or their financial stability. That's a big one for a lot of people. And some, like I said, it's a loss of health. I'm working with a client right now who has stage 4 cancer, and we don't know how much time she's going to have left. So it's interesting working with someone who is actually facing the possibility of death in their future. The nature of grief, it is different for everyone. Our support systems will vary. Resources are not always known or available. Everyone has different coping styles. There are gender differences related to grief. Grief reflects cultural and religious differences, and grief depends on what else is going on in a person's life. Some people are too busy that they don't even stop to take the time to really focus on their grief. And when we go back to the cultural aspect of grief, I knew there were resources available, but I didn't seek them out personally. But I think my biggest help was my own cultural practices that we have. That was how I got myself help, and that is how I keep myself grounded to this day, is to continue the practices of my tribe, our sweat lodges, our Native American church, where everybody's getting ready for the Sundance at home. So those are places where I have gone myself to help heal myself. So those are very important. And like I said, we're all different tribes, so we all have different ways of addressing it. So it's good to get that knowledge from your elders. Different types of grief. Anticipatory, it's experienced before the loss. So this could be my client. We're dealing with everything she's feeling now associated with a diagnosis, acute, chronic, and terminal illnesses such as cancer. Uncomplicated is often referred to as the normal kind of grief, which can include physical, emotional, cognitive, and behavioral responses to the loss. You can change to the next slide. Different types of grief continued. Disenfranchised grief is a loss that can't be openly acknowledged, socially validated, or publicly mourned. Disenfranchised grief often includes grief that is encountered when a loss is experienced but can't be openly acknowledged or publicly shared. Some example I have there is HIV clients, family of HIV patients, mistresses, lovers, spouses, partners, death from substance use, overdose, suicide, and the list goes on there. Also included is our pets. I just read an article recently that said the surveys of the census survey showed that about 57% of families own pets, and we don't often acknowledge people that are going through grief of losing a pet, because those are all important people in our lives. We consider them to be family. Complicated grief. This often includes chronic grief that will not subside and continues over time. It can also be delayed grief that is suppressed and postponed, avoiding the pain of the loss. Exaggerated grief that resorts from self-destructive behavior, and mass grief, grief where the individual isn't even aware that their behaviors are interfering with their normal day-to-day functioning. And this complicated grief, this one concerns me because of what we're going through now. I'm from the Wind River Reservation, and we have a outbreak of the coronavirus there, and the funerals are not the same. And there are people saying, you know, we're not going to do anything right now. We're going to wait until things are better. So that's really going to affect a lot of people. So that it is concerning. Complicated grief, when the grief isn't healing. Again, we've got the chronic, the delayed, and those that choose to avoid it. Chronic sometimes happens when it's one right after another and you don't have time to recover or heal before the next occurs. It makes healing a lot harder. One example would be when we break a bone. We have to take care of that bone and we have to give it time to heal. I have a very good friend, and that's why I took a moment at the beginning. I don't think there's a day that hasn't gone by that I don't think about her. She lost her son when this coronavirus first came, and it wasn't a coronavirus. He passed away, and then a month later, her mother that she's been taking care of passed away. So, and she lost a dog. So she's had 3 huge losses, and this all happened within a month in her life. So, like I said, some of these losses, we can't imagine what they're like for people that have to go through that. Delayed grief could be because of circumstances or personal factors. Like I said, this coronavirus is having people postpone memorials that they want to have for their family members. And then there's those people that are avoiding it. They just want to put a Band-Aid on it. It's still there, but they just do everything they can to distract themselves. They might work a lot and do everything they can to avoid feeling that pain and going through it. We can go to the next slide. Complicated grief is like being in an ongoing heightened state of mourning that keeps a client from healing. And complicated grief feelings of loss are debilitating and don't improve even after time passes. It's sometimes called persistent complex bereavement disorder, and complicated grief. Painful emotions are so long-lasting and severe that someone may have trouble recovering from the loss and resuming their normal life. So here's a lot of things that you might see: the intense sorrow, not focusing on anything else but the death, focusing on reminders, excessive avoidance of reminders, problems accepting the death. And these are when you really need to take a good look at the situation if you don't see people start to get better. And from where I come from as an Arapaho, we have a year. My grandparents told me, you're in mourning for a whole year. So it really helped to have them with experience to help me when I needed it. So we believe when that year is over, it's time to stop crying and it's time to move on. And that was just what I was taught in my family. Complicated grief continued. There are other signs and symptoms that may include recurrent troubling thoughts of death, thinking over and over that they could have done something. You can change the slide. I'm sorry, I forgot to tell you. Maybe thinking they could have prevented the death. That's also known as survivor's guilt. They may exhibit behaviors to block out the activity, leaving a room of possessions untouched, spending a lot of time daydreaming about being with the deceased person, protecting themselves from being reminded of them, trying to avoid people or places. Again, feelings of anger and guilt that are difficult to control. Change the slide. Complicated grief continues when someone has trouble carrying out their normal routines, they're isolating from other people and withdrawing from social activities, they're stuck. They may have health issues, their health could be jeopardized, they could be experiencing depression. So this is when you really want to look at, is this grief or does this person really have some serious depression that needs to be treated? They believe that they did something wrong or could have prevented the death, feel that life is worthless without their loved one, and they wish that they had died too, or they should have been the one to die and not that person. Then change the slide. Some risk factors related to complicated grief. It occurs more often in females and with older people. They may involve the risk of developing complicated, the risk factors involved may be losing a loved one in a sudden or violent way, unexpected or violent death, such as a car accident, murder, or the suicide of a loved one, death of a child, close or dependent relationships to the deceased person, being isolated, not having a support system or friends. Individuals can be vulnerable to anxiety or other mood disorders. Again, that's why I say when their grief goes on for too long, you might want to be looking at these possible disorders that also needs to be addressed. Traumatic childhood experiences, major life stressors such as financial hardships, difficult relationships with parents growing up. And we can go to the next slide. Support for complicated grief. One way to be supportive to these people, whether you work as a counselor or not, and like I say in all of my presentations, you don't have to have a degree to do this. I work with peer specialists that work in my company, and they're some of the best people. I've had them come to me and say, I'm not a counselor, and I'm like, yeah, you are. And I help them realize that they can help people. The first one is just be present and be available. Understand that they may feel abandoned and recognize that you could inadvertently contribute to these feelings. Take the initiative in making contact. Don't expect reciprocity during the acute grief. Understand the bereaved person might not be able to meet expectations and demands during this time. Listen. Listen closely. Share your knowledge and advice sensitively and honestly if requested. Be willing to sit in silence, squeeze their hand or give them a hug. Encourage honest disclosure from the bereaved. Let them know it's okay to cry and to be sad, scared, or angry. Make it known that you're not judging them and you understand that a grieving person might feel a need to put up a front because they're worried that other people can't deal with their emotions, and encourage them not to do this with you. Let them be open with you. They need a safe place. You can go to the next slide. Some more support would be providing help with problem solving in the spirit of partnership and not as an authority. Be honest when you are uncertain about what might help and share this with the person in a respectful way. Let the bereaved person lean on you, especially in ways that are not so obvious. Be respectful of their mourning process and patient with its progress. Have faith in the person. Remember the deceased person and talk about the person. Look for ways to promote positive ways to share their feelings and to look to find some hope in their future, not to feel discouraged by the natural sadness. And I do substance abuse evaluations also, and I have to ask that question if they've experienced a loss in their life or if they have depression. And I want to say 9 times out of 10, they will share a grief response. And then I'll remind them, that's a totally normal reaction to that loss in your life. What I'm looking for is depression, and some of the symptoms may be the same at that time. That's why when the grief looks complicated, we need to look at the time and how long they've been going through that. Some more support for them would be showing respect for their need for independence and solitude while making clear that you are available, and let them know that you want to stay in touch for the long haul. Make it clear you understand there's going to be days that are going to be really hard and you want to be there during those times for them. Be aware of your own feelings and what you want from the bereaved person that they can't give you right now. Don't try to push feelings away. Don't try to find other ways to have your own needs met. This is about them. Encourage them to ask for help. Ask them what you can do, and if they don't know, offer some suggestions. You might be able to help with errands, go with them on a walk or drive or take a trip with them. Just spend some time with that person because all they need is just someone to be there. We can go to the next slide. Some physical response to grief. Be tightness in the throat, heaviness in the chest, feeling in the stomach, hollowness, loss of appetite and appetite change, difficulty sleeping, change in the mood. And when, as I was putting these slides together, I was thinking of sometimes I like to put little short video clips into my presentations. And I was thinking of the movie Smoke Signals when Victor's dad leaves and his mom is there, and she said she felt like her head was in the one room and her stomach was in another. You know, it causes all kinds of painful physical responses. We can go to the next slide. Some emotional responses: anger, fear, anxious, confused, depressed, detached, helpless, hopeless. There's a lot of feelings going on there for that one person. It's just a whole roller coaster of emotions. Emotional responses to grief, again, a lot of the same: resentment, sad, shocked, lost. It is a void that will be filled over time, but it doesn't feel like that when you're going through it. Some cognitive responses to grief: confusion, not able to concentrate, preoccupied with images and thoughts, especially if there's PTSD. If this was a traumatic incident, there could be some PTSD going on, so you have to be mindful of that as well. Dreaming about the deceased person, disbelief, and looking for meaning in life. That's probably the most important thing at the very end, is being able to make meaning of this. We can go on to the next slide. Some behavioral responses to grief can impair your work and school performance: crying, withdrawal, avoiding reminders of the deceased, seeking or carrying reminders of the deceased, overreactivity, changed relationships, and some self-destructive behaviors. I don't know how many times I have encountered this situation, again, when I'm doing assessments. What happened before the incident occurred that brings them into treatment? Oh, my mom died, my dad died, or it was the anniversary of my mom's death, something having to do with grief and loss. So that is always a trigger to me that this person needs to do some grief work, maybe to help them get past that and find other ways to cope. Substance abuse only numbs the pain and prevents someone from working through the task of grieving. Recovery can be a time of facing a number of losses. Providing a safe, supportive place will allow them to feel their feelings and work through the pain of their loss. It seems impossible, but it can be done. Next slide. Some spiritual responses to grief: a loss of faith in God, confusion about God, questioning God, why me, why them, just not understanding it at all. Angry with God about the death, abandoning religious practices, not attending worship services, and wondering about meaning and purpose. And this one I can really relate to, about being angry and abandoning religious practices. Being raised by my grandmother, not only did they teach me our traditional ways, they were also devout Catholic members of the church. And when my brother committed suicide, I was taught that was just like a ultimate sin. And I withdrew from that church for several years after that, just because of that one reason. But again, I kept my Arapaho life the way it was, because that's what was helping me the most at the time. This is an interesting book that I thought I would share. If any of you are interested in doing some reading, I sometimes recommend it, because we all go through different stages throughout the grief period. So it might be a book if anyone's interested. Next slide, the grief cycle. We go through a lot of emotions, as you can see, and for some people, that's a panic button. The type of life we live depends on how we work through our grieving. Good grieving engages us to move more fully into life. Elizabeth Kubler-Ross was probably one of the first people who did research on grief counseling and came up with her theory of the 5 stages of grief that includes denial, anger, bargaining, depression, and acceptance. And David Kessler, if you're looking for some good material on grief and loss, he's also on audiobooks. He has some good information on adding the 6th stage to this, and that 6th stage to this 5 stages is making meaning. So it's really good if you want to listen to it or get his book. This is Kubler-Ross's grief cycle. As you can see, there's denial, anger, depression, people bargaining, and acceptance. And we don't all go through that, and I don't know why that's doing that, but that's just to give you an idea of what those stages are. And we can go to the next slide. The next one is, I thought this was more accurate depiction of what going through grief might be like, because they have this dip here that goes down of all of these stages of the more negative sides of depression symptoms, and then coming back up, getting new strengths, new relationships, new patterns, helping others. And then for me personally, I can relate to the scribble marks. I probably went through all of that through several years of my life and not even realizing it until I actually took the time to study grief and loss. We can move to the next slide. I notice we're running short on time, so I'm sorry if I seem to be speeding up. As we navigate the changes, we experience a sense of loss we have about the changes as we move along a continuum. From chaos after the loss occurs to a new normal, our homeostasis, letting go of what was and accepting what is becoming into being. So it's, like I said, it's something that we all go through, and we have to take the time to allow ourselves to feel those feelings and go through the healing process. And go to the next slide. Again, this is another brainstorming activity. If we were actually in a room together, I often have people that are sitting together do some of these and share. But grieving is an emotional, mental, social, spiritual, and physical response to loss. Our behavioral is the crying, listlessness, sleeplessness, emotional, physical, and cognitive. And I tell people this is not a good time to make major decisions. Some people might want to move or quit their job, and so they really need to be careful in making decisions, major decisions during this time. Move to the next slide. Some common responses and comments that you hear from people, and I always see when I'm looking on Facebook, I see people when they have lost someone, and some of these are common responses. And people mean well. They don't actually know what to say. They're just trying to, you know, offer some comfort to the person, and sometimes we don't take it very well. And we can go to the next slide. Some more common responses. You're going to get over it in time. Snap out of it. You got to be strong. They lived a good life. Yeah, I can relate to this snap out of it. After I did lose my brother myself, I remember I did go to the clinic and they gave me some pills. We can go to the next slide. Some more common responses. And they gave me some pills, and all I did was sleep. I would just get up and maybe drink some water or something and go back to bed again. And my grandmother on my Shoshone side, my Shoshone grandmother, she never came into my grandma and grandpa's house. And that's the first time, probably only time she ever walked into that house. She came into my bedroom and she took that bottle of pills and she went and flushed them down the toilet, and she told me to get up and, you know, wake up. And it really helped me. They say you shouldn't do that, but she really helped me get up and get going and snap myself out of it. And I was like, whoa. So be careful when you do go to see a doctor if they give you any medication, because I wouldn't want anyone to get dependent on relying on a medicine to get through. Some things that you can say or do. Switch to the next slide. Letting people know you're sorry for their loss. Sometimes I'm just at a loss of words altogether. You know, they just want you to listen and just be there. I think one of the things that I remember the most is having my best friend always there. She wasn't really talking about them, but anything I needed, she was there to go and do it. So it's always good to have friends around. Some warning signs that someone needs help, and this is what I was talking about earlier, is, you know, you're very, very concerned about them. Like I shared with you, I had a friend, I was very concerned about her because I thought, gosh, it's been a long time and she's still struggling with the loss of her mom. And her family was talking about it as well. She went to the doctor and then she got diagnosed with MS. And we were like, gosh, no wonder why she was going through a lot. She had some other things going on. So my friend who has MS, still taking her medication. She's doing a lot better now. She did go get help. So we do go through a lot of reactions. We did see the scribbling. Grief work. The goal is not to forget them, but to remember with less pain. Developing adaptive coping mechanisms and finding meaning. It's being able to find meaning. And I shared with you all in the first presentation I did on the suicide that losing my brother the way I did had a profound impact on my life. But my meaning was finding books to read and deciding that I wanted to help prevent suicide and I wanted to help people. So for me, that adds meaning to my life, to be able to honor them. And I lost my mother when she was 42. So my way of honoring my mother is being able to live for all the years that she missed out on. So I have to think of, you know, what can we do to honor that person that we lost? Again, some more advice to help people. Listen to them. Everyone's grief is unique. Offer some help. Maybe you can run some errands for them. Being aware of those holidays and those anniversaries. Me and my husband share in common, we both don't have parents, but we both remember when their birthday is. And so it's good to remember them. My grandmother used to cook dinners and I would come home and the house would smell good and the table would be set and I'd be like, why are you cooking this big dinner? And she would tell me, my grandmother lost her sons, a lot of her children, sadly. And she would say, oh, it's Emmett's birthday or it's Leland's birthday. And her way of remembering was to have a dinner with the family. If you're providing grief services, consider these guidelines. Know when to listen and be comfortable. Don't give up on them. Some places run on a time clock and sometimes we have to let that time go and just be there for that person. Accept that active listening will feel artificial at first and try using other listening skills. Avoid pushing or imposing and don't expect people to accept your solution and just listen to what they're saying. And when you're grieving, don't do it alone. Get some help. Turn to your friends and family. Join some type of support group. Face your feelings. Look after yourself. Self-care. This is the most important thing, is taking care of yourself. Taking care of your family and be prepared for those grief triggers. I tell my clients that are in treatment, you know, when the anniversary of that event is coming up, what can we do so that we don't have you relapse? I myself have, you can turn to the next slide. There are people that do some grief coaching and offer support and grief counseling. Not everyone has to go to, like I said, I didn't go, and I think it's just because I landed in the helping profession that I'm in, that I've read so much. So I guess I'm a self-help kind of person. I say there's books out there for everything that's going on in our lives, that we can find ways to help ourselves. But can turn to the next slide. My own way of dealing with my grief has been a significant reliance on my cultural lifestyle. I credit my grandfather, who took me to Native American church, and he asked people to pray for me. And at that time, I didn't think they would, would these people want to pray for me? But I started getting better. And the more I went, the better I got. And like I said, my grandparents were big supporters of getting my things ready, telling me my grandpa was coming to take me to go to ceremony. And like I said, that's what helped me and still sustains me to this day. And like I said, you want to rule out if they're having any other problems going on in their life. Helping others through grief, just being there. I think one of the books I read several years ago just said the main thing you can do is just to be there. Your time is worth more than anything. You can go to the next slide. Anger is a normal part of grief. It is one of those stages. When my mom left, she left my little sister, and there were times I was angry because I already had a family and kids of my own, and it was automatically assumed I was taking my sister and all that responsibility that came along with it. So there's ways of helping. I just seen some of the slides that someone had commented on books. One of the best books that I found is called Counseling Strategies for Loss and Grief, and it's by Keren, Keren M. Humphrey, Humphry. It's a really good book, one of the best ones that I would highly recommend. To the next slide. Some more techniques you can use. The Gestalt technique, having someone sit in an empty chair, journaling, writing about it, writing letters to the deceased. I've even heard writing letters from different family members' perspective. Maybe pretend you're your own sister or brother or mom, and really thinking, how did other people in your family feel? Because it never dawned on me when I was going through grieving that my kids were going through it as well. I didn't even think about that. Writing letters, bibliotherapy, if you can find some good books to recommend, give them something to read. And again, our cultural rituals and our customs. To the next slide. Okay, some parting words. We can't give to others what we don't have. Like I said, that self-care is very, very important in helping people. Next slide. Okay, again, self-care, number one. We can't deal with these challenging situations if you're not taking care of yourself first. So like I said today, make sure you practice some self-care. We go on to the next slide. Accept your own feelings, take the time to work on your own grief. Find an outlet. You can go on to the next slide. Again, searching for meaning. You don't see it when you're going through it, but later on, like I said, as I've gone through life on my own, I've been able to reflect back on how I've dealt with my losses in life. The next slide. When is the grieving over? I like to say it never really ends. You always miss those people in your life. There will be certain songs, certain events, certain things that will happen. It's just learning to live your life with that loss. And the more you talk about it, the more I talk about it, the easier it gets for me. They say you're not really over it until you can talk about it without crying. But to be honest, there are still times in my life to this day that I have memories of those people. So, you know, you never want to forget them. We believe to tell stories about them so their life can go on. But it's never really over. It does get easier and it does get more manageable. To me, it's just a lifelong process. And thank you guys. You can go to the next slide. That it's just a normal and necessary part of life. We all go through it at some time, and I thank you guys for taking time out of your schedule to attend this session. And I'll look forward to seeing you guys in, I think it's next month.
Okay, I'm gonna stop sharing here because I want to take a little time for a couple questions that have come.
Okay.
And yeah, I know some people asked again about the handouts of these slides. I'll try to share them here again in the chat pod, and we'll also email that out. And within the next week, we'll be sending out a confirmation of your attendance, and that'll have a link to the recording so you can come and view this again, share it with colleagues, and the handouts will be included in that as well. I noticed we had a question a little bit back, Dr. Garcia, on the making meaning step that you mentioned was added to this, or the stages of grief. Can you talk a little bit more about that, or like what that entails?
This comes from the book of, his name is David Kessler, and it really hit home for me, and it's called Finding Meaning, and his name is David Kessler, Kessler, and it's called The Sixth Stage of Grief. And I've got it on audiobooks. I'm an audiobook fanatic. I say it's the best $15 I spend every month. And it talks about making meaning of that grief, and what does that mean for you to understand what it's like to go through that. And David Kessler also talks, he's experienced grief firsthand in losing his own mother as a child and his father raising him, and that he never really realized what his mom probably went through because she was sick for a long time before she died. And so he was remembering what he went through as a child, and then he was thinking about his dad, who what did that mean for his dad? So he was just like looking at making meaning of the loss of his mom, what it meant for him. And later on, he gets married and has a family, and then he loses a son. And so he shares how he's dealing with, how he has addressed his grief. So being able to make meaning for you so that you're at peace with the loss in your life and being able to move on. Okay.
Okay, and then I know you mentioned a couple other books. I just found the one you had the picture of, the Angry Conversations with God.
Mm-hmm.
And then there was another that was the counseling.
Counseling strategies for loss and grief. I don't know if I can.
I want to put some of those links here in the chat if people were looking.
Oh, here's the camera. Here's the camera. If I can get it to stay. This book that I'm showing you is actually used in counseling classes in the master's program. This is like the newest and best thing out there. I have an older one from when I actually took a class years ago, but I don't think I have it here right now. And then on audiobooks, there's another one called Progressing Through Grief. And that one is by a lady named Stephanie Jose. And that has some exercises you can do for grief and loss. And someone asked if I would send a list. I have some references that I used on the slide that I gave, and I will get something to you. It might be after the fact, but there's a lot of books out there that it's often good to be able to give someone who likes to read a book when you're doing counseling work with them, and then you have something to talk about after they read a certain section of a book, and then you can process that with them.
I see Diane is sharing the Grief Recovery Handbook. So I'll pull these links together too from the chat and make sure that we send this out too in our follow-up email.
Yeah, I don't know. I get a lot of books off from Amazon. I think I work for Amazon, but you can just go into their search section. There we'll go, and they'll pull up some. And what I do is I look at the grief and loss books, and they have them for different age levels. And then, yeah, there's several. If you do grief and loss books on Amazon, a lot will pull up. And what I do is I look at the stars. I like, those star ratings will tell you if this is a good book. And some of them will let you look inside. And if you do Kindle on your phone or your iPad or whatever, if you have actual Kindle, you can get a sample. And I like to look at the samples. And then if you have Kindle, there's a lot of free books if you have the Kindle Unlimited. Right now I'm looking at one, it's called the Grief Recovery Handbook. And it's, if you have a Kindle subscription, it's free. So the Kindle has a lot of free books too that are good, that I've liked. So yeah, so if you just hit that into the search bar on Amazon, I'm Amazon, some people do Barnes and Noble. But you'll find lots of books there.
Well, I don't want to take up too much more of people's time. It's really been a great presentation and a wonderful discussion, and thank people for your sharing. And I hope that being able to talk about this has been, you know, had a piece of healing for some of you who are sharing about your grief that you've been experiencing. And I just, yeah, I want to thank you all for being here and for coming together as a community to talk about this. I want to thank Dr. Garcia for this wonderful presentation. Yeah, it's I love seeing
You're welcome.
And the nodding heads. It's great. Yeah, it's really wonderful to be able to talk about this, and something that we all experience at some point in our life. And yeah, just really appreciate your ability to help us to feel hopeful in the midst of our sadness and our losses. So yeah, I just want to thank you again for presenting for us. And yeah, like she mentioned earlier, I hope that you all have a chance to do some self-care today after kind of delving into like, this topic. It's something that'd be great for you all to do, so I hope you get a chance to do that. Yeah, any final thoughts you wanted to share, Dr. Garcia, before we close out?
Nope, I just appreciate everyone taking time to be here today. It shows that you care and about your people that you work with and help with, and I hope I was able to give you something helpful.
Thank you so much. I just shared our survey in the chat box. If you want to take that survey, I'll send that out in an email here shortly. But again, just I really appreciate Dr. Garcia. What a wonderful teacher, and just it's great to be on here with you all. I hope you have a great day. Thank you.